Alrighty, today I'm going to be performing an IV piggyback administration. First, I'm going to check the provider's orders to verify that I'm giving the correct medication to the right patient at the right frequency, the right dose, the right route, and documenting properly. I'm going to make sure I take the medication to the patient at the right time according to agency policy, and I'm going to make sure that any time critical medications are given at that time order, such as stat or now medications. I'm going to ensure that the drug I'm giving in that piggyback is compatible with the primary running IV solution and any other medications the patient is getting. I'm also going to check the pertinent lab values and see if the patient has a history of allergies. I'm making sure I'm preparing one medication for just one patient at a time. I'm going to calculate the dosage and pull up that medication with a needle and syringe. I'm going to pause twice during my medication prep to compare the med label carefully with the MAR and make sure I've checked the expiration date. Here, that expiration date is January 1st, 2023. I'll be giving 5 milligrams of morphine in a 50 milliliter piggyback to be infused over 5 hours, so the rate is 10 milliliters per hour. And then I would now add the medication to the piggyback, maintaining asepsis. I would make sure to label my patient's piggyback, the bag with the patient's name, drug name, dosage, time of administration, and my initials. So let me do that. Labeled. And now I'm going to enter the patient's room and introduce myself to the patient and family. I'm going to perform hand hygiene. Actually, first I'm going to close the curtain to maintain patient privacy, and then I'm going to perform hand hygiene. I'm going to identify the patient with 2 identifiers, compare that to the MAR and their arm wristband, and I'm going to ask them verbally explain to me any allergies they may have. At the bedside, I'm going to do my 3rd med check, again to compare the MAR with the names of the medications that I'm giving on these labels. I will have talked to the patient about the purpose of each medication, its action, its possible side effects, and adverse effects. I'm going to be giving this through the existing IV line, and I'm going to encourage the patient to report any symptoms of discomfort at the IV site and ask if they have any questions before I begin. I'm going to perform hand hygiene again and apply clean gloves. I'm going to assess the site and palpate the IV site for any signs of phlebitis, pain, heat, erythema, and any signs of infiltration such as coldness, pale skin, or sweating or wetness. And then first I'm going to grab my tubing. I'm going to close the clamp. Then I'm going to spike the bag, keeping it sterile. And then I'm going to move my primary to my lower hook. And I'm going to hang this bag, my piggyback, on the higher hook. Oh, don't break. Okay. Here we go. And then I'm going to prime the drip chamber to get out any air until it's about 2/3 full. I'm going to open the clamp now. Where's the clamp for this? I'm going to open the clamp, and I'm going to prime the tubing, making sure all the air bubbles are gone, and I'm going to make sure this empties into a trash receptacle. So I'm going to uncap, prime the tubing, unclamp into a trash receptacle. Dun, 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 trash receptacle. I'm going to reclamp, a recap for sterility. Put that aside for this moment. I'm going to now take an alcohol swab and clean the Y site of the closest to the patient on the primary IV. Allow that to dry. And then I'm going to insert the secondary tubing. So I'm going to uncap this again. You saw that. And then twist that. I'm now going to set the flow rate of the piggyback to 10 milliliters per hour on my IV infusion pump that I don't have here. I'm now going to trace the tubing from the point of origin, or excuse me, from patient to the point of origin. So I'm to make sure I have no air bubbles and that the tubing is patent. And now I'm going to remove my gloves and do hand hygiene. I'm now going to observe the infusion until it is complete. After it is completed, I'm going to come back, I'm going to do hand hygiene again. I'm going to put on some clean gloves. Clamp the piggyback. And disconnect the tubing at the Y site with aseptic technique. I'm now going to assess the patient for any signs of medication or any signs of reaction to the medication or IV infiltration. I'm going to prepare this tubing for the next piggyback administration according to hospital protocol. I'm going to reestablish the flow rate of the primary infusion that was ordered by the provider. I'm going to remove my gloves and perform hand hygiene. I'm going to dispose of all my supplies. Leave the room clean. I'm going to monitor the site for swelling, any pain, tenderness, erythema, allergies, or adverse reactions they may have. Help the patient into a comfortable position. And place their personal items and toiletries within reach. I'm going to place the call light near them and make sure they understand how to use it. I'm going to raise their side rails up ×2 and lower the bed to its lowest position. I'm going to document in the MAR all the time, drug, dose, document the time of administration, the drug I administered, the dose, the route of the administration, the volume of the fluid, my assessment of the IV site, and the patient's response to the medications, as well as any expected or unexpected outcomes.